let's start by going back a few months. Well, I guess, my gosh, a year and a half now. Mid-March, you're seeing reports coming from across the globe about how fast and furious the coronavirus is spreading. There are already a few cases here. Information is coming across your desk. When did you know how grim things might start to look?
Well, you remember that we declared a disaster in the state of Illinois on March 9th. So if you think about how quickly that developed into a lot of other things, right, where we needed to slow down, stop, businesses, reduce capacity, make sure that kids weren't going to school, because at the time we just didn't know how virulent this was going to be with children either. And then, very importantly, I received from the scientists at Argonne University of Illinois a projection of the number of people who would die if we didn't put a stay-at-home order in place.
And they're studying this based on what they've seen in Europe or in Asia?
Correct. They were taking data that they had seen from across the globe, and they had also seen the data that we were gathering in Illinois. And even though there were only dozens of cases at that point, they could see how fast it was moving from one person to another, and how fast people were getting sick.
There was urgency.
They expressed real urgency, and they came to me with a set of projections.
But that study, I think I saw it in the aftermath. Wasn't that measuring the city of Chicago mainly?
No, so I don't know what study you saw, but here's what I'll tell you. They came with a study that showed us, among other things, that in the city of Chicago, just to give you one area of the state, that we could see 20,000 deaths by August of 2020 if we did not put a stay-at-home order in place. And they did this, again, based upon all the data that they got from around the world. So I took one look at that. I called a few doctors and a couple of scientists to ask them, does this seem right to you? And I showed them a couple of pages.
It's a stunning number.
It is a stunning number, 20,000 people in a few months. What would happen over the course of a year? And we didn't know whether we'd have vaccines or not. So it was my job, whether people liked it politically or not. And I didn't think about the politics. I was just focused on saving lives. That's my job as governor, right? You run for office thinking I want to make people's lives better. You want people to be able to send their kids to college. You want people to be able to afford a home, better job, a higher wage.
Nobody campaigns on a stay-at-home order.
Nobody campaigns thinking about a global pandemic is going to come and you're going to have to do things to keep people alive. And so when that moment came, it was clear to me that I needed to act, and I had to gather the leaders in Springfield. I had to talk to the mayor of Chicago. I talked to leaders of counties, large counties in the state, to let them know this is coming, and it's coming tomorrow. And some of them didn't want to see it. They didn't want it to happen, but it had to happen, and so we did that.
The reason I asked about Chicago and the study there is because I have wondered for a while how population density itself accelerated the spread. We just didn't see the rapid spread at first downstate. And I wonder, a lot of people might have looked at the stay-at-home orders or the news coverage and felt that was still half a world away. It'll never get to my small town of 600 people. Eventually, you would implement a regional approach. First, it was statewide. 4 weeks later, it was 4 regions. Then weeks later after that, I think 2 months later, it was 11 regions. Then later, you were going back to statewide again in the fall. So how are you evaluating that issue, that metric of population density, the spread of it, and would you do any of that differently now?
Well, when we saw those projections, right, those were based in part on what was going on in Italy, in Spain, in France, et cetera.
In big population centers?
No, also in their rural areas. And so what we looked at was, we don't know exactly how this thing spreads. Remember, this is March of 2020. This is a novel coronavirus. Even the scientists were, still learning about this. And so what we needed to make sure was we weren't leaving anybody out of being saved, or that, we didn't want people to go in the hospital no matter where they lived. So we began with a stay-at-home order across the state. And we saw, as you said, that in some more rural areas, we didn't see the spread that you would expect. And so that's when we moved to a more regional approach. And then you saw something happen that nobody expected. the reverse. Chicago was doing better than areas of downstate that are more rural.
They had the muscle memory. They had the infrastructure sort of built up, the medical infrastructure.
You can say what you like, but the fact is people are getting sick and dying downstate when they hadn't been at the beginning of this pandemic. And so my job, again, I don't, whether they voted for me or didn't vote for me, whether I live in that area or don't live in that area, I'm the governor of the entire state of Illinois. I need to keep people safe everywhere.
Would you have made that stay-at-home order statewide again on March 20th if you had to do over again?
There are an awful lot of things, Mark, that you could look back and in hindsight say, should I have done this, should I have done that? We operated on the best information that was available at the time and got the best doctors advising us and best scientists advising us. And I had to make decisions because every minute counted.
That sounds like a yes, that you would do it again.
All I can tell you is that I suppose there are things that you might do differently if you said, well, with what I know now, is there something different I would have done then? I just can't look back like that. What I have to think about is, in the moment with the best information available, how do I keep people safe?
You mentioned that you had doctors advising you, scientists compiling research, but the state's pandemic preparedness playbook that the state had in place, I think it was updated last in 2014, then again just a few months before the pandemic started to outbreak here. It said that the state's primary goals are to prevent morbidity, mortality, and to prevent social disruption. What are some ways that your administration tried to prevent social disruption?
Well, again, remember that our job here was to keep people alive, keep them safe, make sure our hospitals were available. Because what people don't pay attention to is when you fill up your hospital beds with people with a pandemic disease, you're not able to serve people who have heart attacks or get in car accidents or the many other things that people go to hospitals for. So what you don't want is your hospitals overrun. So we tried to take all of that into account. What you would have is you truly would have real unrest and a lot of death if we had let our hospitals get overrun. Thank God we acted early enough, and we made sure that we had overflow capacity. If our hospitals did get to a point where they were overcome, we could move people who were in better condition to these alternative care facilities and keep our hospitals, our critical care hospitals, open.
In going through this experience, I hope we learned a lot about how to avoid it ever again. I don't know that we can sustain that kind of an economic fallout again, certainly not in the near term. What are ways that we can make sure, what are you doing now to make sure that this will never happen again? The statewide shutdowns, all of that.
Well, there's nothing I can do to prevent another pandemic. That's not something that
But the way we
state has the
react to it?
capability to do. Certainly we should react differently. Let's start with this. We should never have a president like we had last year. That president was terrible for America. People died as a result of his intransigence, of his denying the existence of this, calling it a hoax, saying it was going to disappear, not preparing and not helping states and real people all across this nation. I mean, we had to go it alone. And we did that. We succeeded at that. We went and got our own PPE, competing with California and New York and all the states in the United States, not to mention other countries, when the United States government could have, with all of its might and all of its purchasing power, gone and done what we ended up having to do all by ourselves. And so many other things where we asked for help from the federal government, and they basically said, it's your problem. Now, look at the contrast. We have a president now who actually cares, who is actually operating in the best interests of our states and our people. And when we call and say we have a problem, they act. So that's one thing that I wish we could have changed. Unfortunately, that's the situation that we got, and we dealt with it as best we could, and I think we did very well in Illinois.
You're also operating in Illinois among 49 other governors who have a varying degree of politics of their own, and for them it's easy to say, or maybe it was easier, more popular to say, we're going to reopen, we're going to open faster. We didn't see, for example, Florida, I think, took that tack. They tried to open up faster. They had fewer deaths overall at the end of all this than Illinois did.
That's not true, but
Per capita.
what is true is that you saw different states, and this is something we don't know about this coronavirus still. We saw different states having waves of coronavirus hitting their people and people dying at different moments. When Illinois was doing very well during the summer, what was happening in Florida, Texas, and Arizona? People were dying in droves.
The waves happened in different times for sure. But
they did, and my point is that and we don't know, for example, Does climate have something to do with it? Does humidity have something to do with it? We really don't know, because you could look state by state by state and see very different outcomes from one place to another. Nobody knew. Look what happened in New York. Look at what happened in New York. Who knew that New York was going to go off the charts? It wasn't just New York City, the entire state of New York. Michigan, we didn't, what befell Michigan and New York didn't happen in Illinois. Part of it was we acted quickly. Part of it is there were things about this coronavirus we still don't know. But here's what I know. Our job was to keep people alive. Our job was to keep people safe. And by the way, our economy actually did, comparatively reasonably well in the context of people having to lose their jobs as a result of a stay-at-home order or as a result of this virus having a terrible effect across our state.
As we talk to you now, we still haven't recovered half of the jobs that we lost during the pandemic in Illinois.
Right.
Do you believe that you're addressing that problem, the reopening and the restoration of our economy, with the same urgency that you had on March 20th when you had to give that order to stay home?
We are acting with great urgency. I want people to get back to work. And remember, you're trying to balance interests. Over the course of the last number of months, we had an upsurge of coronavirus in Illinois. And in some places they didn't. But we had an upsurge. We had to deal with that. That has an effect. But here's what we're doing now, right? We've made, basically, because our economy actually got on quite a roll, we added about 93,000 jobs in the first 3 months. Think about that. If you could do that on an annualized basis, we'd be in great shape. We're hoping that that's what's happening over the next few months as well. So collectively, though, I've been working very hard to bring companies to the state of Illinois to make sure that we're reopening as much as we can in the state. And on June 11th, we're going to have a complete reopening, phase 5 in Illinois, which I think is a moment to rejoice at. Also, I've reached out and we've brought electric car companies to the state of Illinois. We've reached out and made sure that we're building up new companies within the state, business startups. I don't know if you know this, but in the Midwest, Illinois had the most business startups in 2020 of any state across the Midwest. That's pretty tremendous, right? 169,000 new businesses got created in the year 2020. It's partly because we created an innovation economy here that people want to participate in.
Mm-hmm. We were speaking with Dr. Ezike about how much of the public health crisis was a public communication crisis. The state's pandemic preparedness playbook addresses this as well. In fact, it says it's your job as governor to communicate with the public on a number of different issues. But that was written in a different time, maybe when we were a kinder, gentler nation. It's a little bit more politically polarized today. Do you believe today, after what you went through the last year and a half, that a politician is the best messenger in a public health crisis compared to, say, a doctor?
Well, virtually every day you saw that I stood at that podium with Dr. Ezike. And I brought doctors from Illinois and from other parts of the state, not just from Chicago, but other parts of the state, and even from outside the state, to make sure that we were making the points to people on the basis of science. And that was an important role that I played, communicating to people and using the facts to communicate with them, being transparent about all of it. That's tremendously important. That is something the CDC actually trains people to do, doctors to do, and it's something that I got on the job training doing. I already knew that what was important here, especially when you have a president in Washington who is lying about this virus, you needed somebody that you could rely upon to give you the facts. And when, as you pointed out earlier, there are things that I didn't know about the science or understanding the disease itself, I would bring to the podium the people who did understand that.
I asked Dr. Ezike this question, looking forward to the future. I asked Dr. Ezike the same question here, but a lot of Americans are itching and eager to get back to a concert. Any musician, living or dead, who'd you like to go see if you could for the first concert?
Oh my goodness. I have a lot of favorites. Let me start by saying that one of my favorite musicians is James Taylor. So that's somebody I always will choose. But I also will say that, we have some great musicians and bands that are from Illinois. We just put REO Speedwagon into a commercial advertising our tourism campaign, and of course Chance the Rapper.
And I think the REO Speedwagon is in the Lincoln Library or museum now, rather. So
That's
people can
right.
go see
There's a
it.
show. Exactly.
Well, thanks for sitting down with us.
Thank you. Good to see you.